Next is Dr. Lakshmi S. Kumar, free paper 66.
Good afternoon. My topic is Prevalence and Determinants of Meibomian Gland Dysfunction, a hospital-based cross-sectional study. Introduction. The International Workshop on MGD defined the disease as a chronic, diffuse abnormality of the meibomian glands, commonly characterized by terminal duct obstruction and or quantitative changes in the glandular secretion. It may result in the alteration of the tear film, symptoms of eye irritation, clinically apparent inflammation, and ocular surface disease. Meibomian gland dysfunction is the most under-recognized, underappreciated, and undertreated disease in ophthalmic care. As you all know, ocular surface is key to surgical outcomes. Cataract and refractive surgeries are the most widely performed surgeries nowadays. The final visual result is largely dependent on the status of tear film to which MGD can contribute. Untreated MGD put these patients at risk for infection or inflammation. So, my aim and objectives of the study: primary objective, to estimate the prevalence of dysfunction of meibomian glands in adult patients attending ophthalmology OPD of our tertiary hospital. Secondary objectives, to describe the socio-demographic characteristics of patients with meibomian gland dysfunction and to assess the determinants of meibomian gland dysfunction. Materials and methods. Study design is a hospital-based cross-sectional study. Study area: the study was conducted in ophthalmology OPD of our tertiary care eye hospital. Study population: patients aged 18 years or more who attended ophthalmology OPD for consultation were included in this study. Inclusion and exclusion criteria: inclusion, adult patients more than 18 years of both genders who attended our OPD. Exclusion criteria: Stevens-Johnson syndrome, chemical or radiation injuries, diseases related to lacrimal drainage system, and the patients who did not give consent. Sampling was consecutive sampling. Sample size calculation: based on the previous study done by Hernandez et al., the sample size was 352. Study tools included slit lamp biomicroscopy, ocular surface disease index questionnaire, fluorescein strips, lipid profile, HbA1c, and thyroid profile. Study procedure: patient who came to our routine OPD was examined with slit lamp. Meibomian gland orifice was observed in the eyelids and examined for any plugging, pouting of orifices, loss of cuffing, frothy discharge in at least one eye using slit lamp biomicroscopy. Eyelid margin was noted for thickness, rounding of margins, irregularity, vascularity, loss of lash, trichiasis, and malapposition. Mucocutaneous junction was assessed for androplacement, retroplacement, ridging, and mucosal absorption. In those with MGD features, detailed history taking was done, including all the comorbidities, and then ocular surface disease index questionnaire was given. The MEIBOM quality score assessment was done by applying digital pressure on the glands. Tear film breakup time, tear film height measurement, and ocular surface grading was done. Patients were investigated for glycated hemoglobin, thyroid function test, and lipid profile. Results of my study: out of 352 patients who came to our OPD, 123 patients has got MGD, which accounts for nearly 34.9%. Coming to socio-demography, habits, and comorbidities. In the MGD patients, 61 to 80 age group are more prone for MGD in my study, and males are more prone for meibomian gland dysfunction, and BPL patients, that is below poverty line patients, are more prone for meibomian gland dysfunction. Smoking and alcohol has got a definite association with meibomian gland dysfunction, and the comorbidities included diabetes, hypertension, coronary artery disease, dyslipidemia, thyroid disorder, mental health disorder, and sleep disorder, out of which dyslipidemia is more prominent. And the comparison of characteristics between cases with and without meibomian gland dysfunction: out of this, smoking and alcohol are found to be higher in meibomian gland dysfunction, but there is no significant association with meibomian gland dysfunction. But a significant association was noted with diabetes, hypertension, coronary artery disease, dyslipidemia, sleep disorder, thyroid disorder, and mental health disorder. Symptoms based on OSDI questionnaire: most of the patients presented to me were asymptomatic. Mild dry eye was present in 10 patients, moderate in 15 patients, severe in 29 patients. Distribution of MEIBOM quality score among meibomian gland dysfunction patients: most of the patients presented with clear fluid only on digital pressure. Objective measurement of ocular surface, which include tear film height measurement: most of the patients with MGD has got tear film height of 1 mm. And fluorescent breakup time among MGD patients, majority of meibomian gland dysfunction patients had T-but of 5 to 10 seconds. Less than 5 seconds were noted only in 3 patients. Classification of meibomian gland dysfunction based on ocular surface staining based on Oxford grading system. Most of the patients has got no staining. Discussion, prevalence of meibomian gland dysfunction in my study was 34.9%, which is comparable to a meta-analysis done by Hasendasak et al. 35.8% was the global prevalence of meibomian gland dysfunction. Males are affected more when compared to females in my study. This is similar to the Binch-Hung et al. Study. Most of the cases had normal ocular surface and severe dry eye was noted only in 1/4 of the patients. This is similar to that of the Rebensteiner et al. Study, which showed pure MGD showed lower severity of signs of ocular surface damage. Smoking and alcohol consumption was reported to be higher among MGD cases, but no significant association was noted in my study. Mathurkar et al. Showed significant association between smoking and meibomian gland dysfunction, while Tulasian et al. Showed no significant association. Significant association between MGD and diabetes, hypertension, dyslipidemia, CAD, thyroid disorder, sleep disorder, and mental health disorder was noted. Kaur et al. Showed significant association with diabetes, hyperlipidemia, and sleep disorders. Wang et al. Showed association with thyroid disorder, and Shen et al. Showed significant association with cardiovascular disease. Conclusion, 1/3 of patients attending ophthalmology OPD suffer from meibomian gland dysfunction and showed a significant association with the above mentioned comorbidities. Limitation, it is a single center study, it's a self-reported data, and the recommendations include regular screening of the patients, lifestyle modifications, comprehensive management should be done, and further research has to be done. These are my references, and thank you.
Thank you, ma'am.